Albinism and neuronal linkage. Most people think albinism is only changes in skin, hair, and eye color, but the real story is inside the visual nervous system. In albinism, reduced melanin affects the retina, fovea, optic nerve, and visual cortex. This can cause light sensitivity, poor vision, nystagmus, reduced depth perception, and difficulty with visual learning. So, albinism is not just a pigment disorder, it also linked with how the brain receives and processes visual signals. Let's understand the neuronal mechanism behind albinism. Albinism and neuronal linkage. Albinism is genetic disorder of reduced melanin production. Key diagnostic findings, treatment, supportive care, and prognosis is necessary to diagnose the type of albinism which the patient have and the treatment. Overview. The major types of albinism: oculocutaneous albinism, ocular albinism, and syndromic albinism. Common visual features include photophobia, nystagmus, strabismus, foveal hypoplasia, and reduced visual acuity. That is the mechanism of disease, that how this disease occurred in patient, starting with the genetic mutation in different type of genes, tyrosine, OCA2, TRP1, SLC, and GRP143. That is the mechanism flowchart. Genetic mutation in these genes causes impaired melanin synthesis or development and transport difficulties, reduced skin, hair, and ocular pigment, abnormal retinal pigment epithelium, and visual pathway abnormalities, causes foveal hypoplasia, optic nerve misrouting, altered LGN and visual cortex input, photophobia, and nystagmus. These are the final clinical outcomes that the patient have or diagnosed by the physician. That is the neuronal linkage mechanism: retina, low melanin, foveal hypoplasia, optic nerve fibers, optic chiasm misrouting, LGM, and visual cortex. What happens in albinism? Optic nerve fiber cross abnormally at the optic chiasm. Visual cortex receive altered binocular input. Clinical expression: reduced visual activity or acuity, nystagmus or poor fixation, strabismus, and reduced depth perception, photophobia, and glare sensitivity. The neuronal mechanism: gene mutation, reduce melanin synthesis, reduce or decrease abnormal retinal pigment epithelium, decrease foveal hypoplasia and unstable fixation, decrease optic nerve fiber misrouting or at optic chiasm, decrease altered input to lateral geniculate nucleus and visual cortex, decrease reduced activity, photophobia and nystagmus, strabismus, and impaired binocular vision. That is the pathway. You can also call that visual pathway images. These are the genes responsible: uh, tyrosine, OCA2, TRP1, SLC, 4582, GPR143, HPS gene, and LYST. These are the few genes that are responsible in albinism and its type. Diagnosis. Visual acuity testing, nystagmus or strabismus assessment, iris mass illumination and retinal pigmentation, foveal hypoplasia and OCT, and defective error evaluation. Assess for syndromic features, bleeding, immune problem, lungs, bowel, kidney, or neurological complication should be monitored by the physician for the complete diagnosis of the type and uh, effect of this disease on different parts of the body, especially the eye. Treatment, sun protection, dermatological care, ocular and visual care, education and social support, syndromic albinism. Prognosis, good prognostic factors included early diagnosis and eye care, consistent sun protection, regular dermatological and other uh, surveillances that the physician do with the patient, low vision on sport, educational accommodation, no syndromic complications. Challenges, persistent reduced visual activity, photophobia, nystagmus, strabismus, skin care, skin cancer risk with visual UV ultraviolet exposure, and psychological stress and stigma. Syndromic forms, it's quite complicated. Chadic Higashi, immune deficiency, and neurological problem. Outcome depends on systemic involvement and specialist care. Albinism is an inherited disorder, reduced melanin synthesis or malform function, especially diagnosis requires skin eye examination, ophthalmic testing, and genetic information uh, one feasible. Treatment focuses on sun protection, eye care, low vision support, educational support, and monitoring for skin cancer. Non-syndromic albinism usually has normal lifespan as compared to syndromic one. Thanks and regards. Please like and subscribe this channel for further discussion on different diseases.